Good afternoon. My name is Dr. Gail Brendel, and I'm thrilled to be here with you this afternoon to present to you the findings of my doctoral research project titled Self-Care for Chronic Pain Management Among Veterans, an Appreciative Inquiry. If you have any questions or comments, you can find my contact information at the end of this presentation. Thank you for watching. Chronic pain is associated with significant disability and cost to the United States economy. The total cost associated with pain in terms of health care cost and lost productivity is estimated to be between $560 and $635 billion annually. The economic burden of chronic pain in the U.S. exceeds that of the three highest chronic health conditions combined: heart disease, cancer, and diabetes. As many as 100 million American adults are afflicted with some form of chronic pain, and over 80 Americans die each day from overdoses related to the treatment of chronic pain. Military personnel and veterans experience higher rates of chronic pain than the general population. Estimates of pain prevalence among our active duty personnel range from 44 to 75%, compared to only 26 to 56.4% in the general population. Because military personnel are more likely to experience chronic pain, this epidemic has also been considered a national defense crisis. Data from the National Health Interview Survey revealed that over 65% of military veterans report being in some type of pain. Younger veterans, those who served during the Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn eras, aged 18 to 39, are more likely to report having severe pain compared to non-veterans of the same age group. And female veterans are 1.5 times more likely to have severe pain than their male counterparts. The purpose of this study was to use appreciative inquiry as an action-oriented research approach to focus on a time when patients and providers expressed being at their best pertaining to their experiences associated with Step 1 of the SCM-PM. In 2009, the Department of Defense and the Veterans Health Administration implemented the STEP care model for pain management in order to improve chronic pain management of active duty and military veterans. The SCM-PM is an evidence-based model developed to give providers a systematic single standard of pain care designed to provide the best pain treatment options for patients, while giving the patient greater responsibility for self-management of their pain. The concept involves the patient assuming an active role to develop the skills and confidence needed to manage their chronic pain using self-care modalities. 3 objectives were established for this study. They were to identify what is working well within Step 1 of the STEP care model of pain management, determine if improvements could be made to Step 1 of the model, and finally, to bring awareness of those factors that influence health behavior change to military veterans and decision makers. George Engel's biopsychosocial theory and Ronald Melzak's neuromatrix theory were used as the theoretical frameworks for the basis of this study. The research question asked, what aspects of Step 1, self-care, of the STEP care model for pain management are essential elements for successful chronic pain management for military veterans of the Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn era? The Appreciative Inquiry 4D platform was used as the design for this study, originally developed by David Cooperrider in the mid-1980s. The Appreciative Inquiry model involves a systematic discovery of what gives life to a system or an organization was most effective. Instead of focusing on trying to solve problems, the AI process takes a positive approach, focusing on creating sustainable change from an appreciative eye, and then focuses on the strengths, aspirations, and success stories of the individuals involved. 4 phases are involved: discovery, which is appreciating the best of what is; dreaming, which is envisioning future possibilities; design, co-constructing provocative ideas for what should be an ideal situation; and destiny. These are sustainable and actionable steps for constructing the future. For data collection and analysis, using non-probability convenience and purposive sampling, 5 veterans between the ages of 18 and 35 who participated in Step 1 of the model, and 2 providers who were treating veterans using self-care were recruited for this study. For data collection and analysis, semi-structured, open-ended, and audio-recorded interviews served as the primary source for data collection, and the participant demographic forms served as supporting documentation. All interviews were transcribed using the NVivo 12 transcription software by QSR International, and all 7 interviews were manually coded and reviewed for emerging themes. 8 themes emerged from the data collection process. For the discovery phase of appreciating what gives life to their experiences with self-care, the veterans reported that caring and trusted providers matter, and that needing assistance with sleep, including understanding the importance of self-care, were critical. When veterans truly felt cared for, they were more likely to perform self-care routines. They realized that sleep quality and pain perception were closely related and expressed the need to learn more about how to improve sleep. Providers reported that they saw better outcomes with their patients when the patient believed that the provider truly cared about them, and also when they were providing truly holistic care. The AI dream phase encouraged participants to imagine future possibilities in self-care for chronic pain where there were no limitations, and patients and providers would work together to create a pain-free life. 4 themes emerged here, and when creatively imagining a perfect world where anything is possible, both veterans and providers said that having an advocate at the VA who is both knowledgeable in CAM therapies and the pain process, and who also knew how to navigate the VA system, was important. Veterans also reported that when their provider asked about their home life and relationships, they felt truly cared for. As we moved into the design phase, this is where we encourage participants to be innovative in creating their perfect world of self-care. Veterans reported when they received holistic care from providers they trusted, and when their providers communicated with them, and when they truly felt cared for, this is when these veterans practiced self-care more often. They reported that having an advocate within the VA system who supported them would make a big difference. Having strong support systems at home and within the VA that included open communication, connectedness, and relatability emerged as a new theme. In the final inquiry phase of Destiny, participants were encouraged, while thinking about their dreams and the future they had created in the previous phases, to design a sustainable future where veterans felt empowered and in control of their self-care and pain management. Once again, the themes of need for truly holistic care and affordable and convenient resources for CAM therapies emerged. Participants believed that if the funding, educational resources, and CAM therapies were easily accessible, then self-care for chronic pain would be more successful. The theme of strong support and accountability systems are important. This emerged again as a necessary component for having effective and sustainable practices. And when providers were asked what personal experiences the patient brought to bear on his or her own situation, the theme of individual tenacity and grit emerged as a common trait among veterans that helped them overcome very challenging obstacles and begin living a productive, healthy, and sustainable life. Implications for theory and practice. Future research should examine these CAM therapies for effectiveness, accessibility, and reliability within large-scale controlled studies, including the use of medical marijuana. Results from this study may potentially bridge the gap between research and practice related to chronic pain management and treatment. The collective insights from the patients and providers may inform researchers and clinicians on better ways to develop and implement treatments. The patient-provider relationship is critical for successful outcomes. And finally, merging current evidence-based resiliency programs utilized by active duty military with the current pain treatment models may be an opportunity to join forces to change the way chronic pain treatment is delivered. So in conclusion, the research question was answered in this study. And here again we have the 8 themes that emerged. Patient-centered holistic care from caring and trusted providers is critical for sustained positive outcomes in chronic pain management among veterans. Addressing chronic pain treatment from a biopsychosocial perspective may lead to better outcomes in pain management, patient commitment, and opioid-related problems. And finally, findings from this study support the literature on the value and effectiveness of evidence-based CAM therapies for treating chronic pain. This concludes my presentation. If you should have any questions or comments, my contact information is listed below. Thank you for watching.